Hi, I'm Dr. Edma Amaro from the Fertility Center in Nueva Vallarta, Mexico. Today we're going to talk about the most common causes of female infertility. So our first and most common cause of infertility is the problems during the cycles. So for example, most of our patients struggle with irregular ones. There are a couple of syndromes and diseases that we have to seek out and to discard when we are evaluating our patients. Most commonly PCOS, also called as polycystic syndrome, but we also may have any other type of situations such as fibroid problems, hyperprolactinemia, and hormonal situations that may be affecting the regularity and cycle of their period. The second situation that may be causing this female problem would be infections. So even though the infections have already said to be discarded as an only specific cause of infertility, it's very important to determine that our patients are free from any type of infections. So for example, if you have been struggling with chlamydia, gonorrhea, or any other type of vaginal, cervical vaginal infections, you must be treated. Remember that most of the time, this type of diseases may also affect the tubes, and the tubes are very important during the process of fertilization and implantation. So for example, if you struggle with chlamydia, with an untreated chlamydia infection, then the probabilities of having a dilation in your tubes are high. We have to perform a specific test to find out that you are not struggling with this situation. Whenever we have dilation in our tubes, we can have inflammation secretions that may be affecting directly the implantation process, contaminating the environment, and actually like pushing the embryos outside the uterus cavity. The third cause refers to premature ovarian failure. Whenever we have this type of problem, refers when the woman stops producing their natural hormones and actually they stop ovulating. We can think about this problem when our patients told us that they are living with amenorrhea and with menopause symptoms. Another cause of female infertility will be the presence of fibroids. Fibroids are benign tumors that may be produced and growing inside the uterus. It may be affecting any layer of that organ and also may be very variable in each location and size. Actually, most of the time we recommend to remove the fibroids before any type of embryo transfer, because in that way we are going to have the most chances of getting a pregnancy. Remember that the type of symptoms that you may present with fibroids are going to be related with their size and with their location. But we have also to take in consideration that there are other causes of abnormal bleeding, such as the presence of polyps. Fortunately, the removal of whenever we need to remove polyps, it's very easy because we can do it with an ambulatory surgery, especially with an hysteroscopy, and sometimes fibroids may be removed too in this way. Most of other times, fibroids must be removed with an open surgery just to be sure that your uterus is going to be free and of these problems just before your embryo transfer. Another cause of female infertility will be the endometriosis. For diagnosing the endometriosis, it's very important that we perform several tests and sometimes even a laparoscopy surgery to find out the stage of endometriosis that you have. The stages of endometriosis are going to guide us for the correct treatment and the way that we are going to help you to have a pregnancy. Also, another situation that may be causing the female infertility will be the problems with implantation. That will be a failure implantation. Unfortunately, this kind of diagnosis will only be faced when we have performed several attempts of IVF procedures. We cannot suspect of this kind of problem just at the beginning of the trip. We have to be exposed at least to 3 or 4 embryo transfers just to know that we are struggling with this problem. There are several types of options whenever we have patients with this situation. We have to perform genetic tests in the embryos that we are going to transfer, as well as endometrial receptivity follow-ups and tests to find out that the window of implantation and the embryo are in the correct stage for their communication and for the implantation. Another cause that may be affecting patients with infertility is the autoimmunitary diseases. Sometimes our autoimmune system produces molecules that are going to affect and attack some specific organs, and this pro-inflammatory environment and the presence of these antibodies in your body must be controlled before we perform any type of embryo transfer. Why? Because it's going to be very difficult for you to get pregnant if you don't control, first of all, this type of disease. For example, just to name some of the most common diseases that are autoimmune, we can name rheumatic affections, thyroid affections, semen affections. Okay, so these are just like some examples, but most of the time we have to perform specific immunological blood tests to find out if we are facing this type of problem with you. Okay, remember that we have a lot of other videos very informative regarding endometriosis and polycystic ovarian syndrome, as well as many other ways to understand genetic tests and options that we have to increase the chances of getting pregnant. So go on and watch them all. Okay, I hope that you find very helpful this video, and see you later. Bye bye.